Hello, my name is Dr. Eric Abrams, and I'm a board certified podiatrist here today to speak on behalf of PRP Concepts about their CASCADE autologous platelet system. Over the last 25 years or so, wound care has changed dramatically. We have gone from collagen-based dressings to gels which integrate chemotaxis, or the recruitment of different cellular components to a wound to help try to improve wound healing. We have progressed from there to various types of grafts such as fish skin, porcine, bovine grafts. However, nothing is probably quite as efficient as using a patient's own cellular components to help heal their own personal wounds. So this PRP, or platelet-rich plasma, has been utilized in regenerative medicine in a multitude of specialties. It's been used in dermatology and aesthetics, orthopedics, sports medicine, spine and bone surgery, and now we're utilizing this technology in wound care. It's very important that we talk a little bit about the demographics and the statistics behind diabetes and diabetic wounds. Obesity and the obesity epidemic in the United States is going to reach 50% by the year 2025. As we know, obesity lends itself to an increased risk for diabetes. And 1 in 3 diabetic patients will develop at least one diabetic foot ulcer during their lifetime. These ulcers or wounds are very difficult to treat. Oftentimes, patients with diabetes and a foot ulcer additionally are found to have peripheral arterial disease. This peripheral arterial disease affects over 10 million adults in the United States. There was a study between 2008 and 2018 studying over 6.5 million patients in the Veterans Administration healthcare system. And there was noted to be a 41% increase in lower extremity amputations during that decade. 30% of untreated chronic diabetic wounds will result in amputation, and 75% of diabetic patients that have had an amputation will die within 5 years. What is the CASCADE autologous platelet system? Well, the system is comprised of a centrifuge with pre-programmed spin speeds and times, which are optimized to produce the CASCADE PRFM, or platelet-rich fiber matrix. Additionally, the CASCADE kit contains all of the proprietary sterile and optimized components which are required to draw blood and transfer platelet-rich plasma with their special tubes into a centrifuge for separation and to make the resultant CASCADE PRFM membrane. As we look at this next slide, on the left you'll see a tube of platelet-rich plasma. This is the result of the first spin cycle after we've spun down a patient's own blood. We will transfer this platelet-rich plasma, just the top portion here in the picture, into the PRFM membrane production vial. This vial is placed back in the centrifuge and spun again a second time for a second cycle, creating at the bottom of this vial a platelet-rich fiber matrix membrane. This membrane is completely full of platelets and growth factors, and it's easy to handle, and it's ideal for the application on any type of wound. Besides being from the patient's own blood cells, this platelet-rich fiber matrix is so easy because platelets are readily available from the patient's own blood. As we know, platelets are heavily involved in tissue regeneration and angiogenesis. CASCADE is a leukocyte-poor platelet-rich plasma product, meaning leukocytes, or white blood cells, are filtered out of the process. And this is important because leukocytes trigger the inflammatory response in wound healing, and in a chronic wound can hinder tissue regeneration. The Cascade PRFM membrane releases growth factors for a period of 7 to 10 days in a slow, sustained, and coordinated manner, helping signal cell recruitment at the wound site. When talking about a leukocyte poor product, this is important because Cascade eliminates neutrophils. And unlike many of the competitive products out there, they don't necessarily eliminate neutrophils. And why is this important? Well, we know that neutrophils are the first line of attack in an acute wound. They're very important. They're antimicrobial, and they're integral in that initial inflammatory phase in the cascade of wound healing. But in a chronic wound, neutrophils can produce extracellular traps, also known as nets. And they are large extracellular web-like structures that hinder tissue regeneration by releasing inflammatory cytokines and enzymes that promote pro-inflammatory effects. They can cause damage to growth factors by cleaving them and or hindering or damaging their receptors, preventing the normal cascade process of cellular integration and coordination to heal a wound. So while we're speaking a little bit about neutrophils and its effect on wound healing, I would be remiss if we didn't discuss the role of the macrophage. So there are two types of macrophages to simplify this. The M1 phenotype is responsible for the initial inflammation and angiogenesis, or the inflammatory portion of healing, and the M2 is responsible for the healing and repair. So there's a natural transition from the M1 to the M2 in the healthy wound. In the presence of elevated blood sugar, blood glucose, this transition is inhibited. And there's an increased accumulation of neutrophils as a result of this impaired and damaged M1 macrophage phagocytosis. So the M1 macrophage, which should be phagocytosing neutrophils at this point and then transitioning to the M2 in the high blood sugar environment, this won't happen, creating a backlog and a buildup of neutrophils and their byproducts. This is another reason why there's a chronic inflammatory component and a failure to heal some of these chronic wounds. Another big difference between Cascade and their competition is that Cascade does not use a platelet activator such as thrombin in the production of their PRFM. Flow cytometry studies show that when exogenous thrombin is added to the platelet-rich plasma, or the platelets, a rapid burst of platelet granules is released within 5 minutes of introduction of thrombin, and this prevents the gradual, coordinated, integrated release of a variety of growth factors and interleukins over the course of a 7 to 10 day period, rendering that platelet-rich fibrin matrix with the extrinsic thrombin to not be quite as effective for a prolonged period of time. So Cascade, because it does not use exogenous or extrinsic thrombin, releases growth factors into the wound in a coordinated and continuous process in accordance with the natural genetic sequence without needing this platelet activator. So this permits recruitment of the appropriate cell types into the wound at the proper time over a 7 to 10 day period. If you look at the chart, you'll see that there's up to 168-hour release of a variety of growth factors, including platelet-derived growth factor, endothelial growth factor, insulin-like growth factor, and vascular endothelial growth factors. So Cascade is an effective, efficient, and very easy to use product, and it can be used at a lower cost. Why? Well, no refrigeration or thrombin is required. The process is simple and standardized. It provides consistent, reproducible results. The solid platelet-rich fibrin matrix is easy to handle and easy to apply. and it's versatile. It has broad applications. The lower cost to wound closure is a result of a study that shows 80% of wounds were closed in 12 weeks with less than 3 applications of the CASCADE membrane. And this is without using thrombin, and again, the product is void of neutrophils. So just don't take my word for it. Let's look at some clinical cases to see how this product works and some of the results that we've seen. So this first picture is a pre-treatment image of a 63-year-old non-compliant diabetic patient who presented to my office with a history of a wound on the bottom of his great toe for a duration of over a year and a half. So after debridement, x-rays, antibiotics, MRI, ruling out osteomyelitis, biopsying the ulceration, I was unable to close this for an additional year, over a year. And at that point, I was lucky enough to be introduced to CASCADE, and we discussed this with the patient, and we applied his very first application of the CASCADE membrane sometime in early August of 2022. This next slide shows the wound 2 weeks following the patient's second application. So we applied his first application after debridement in early August of 2022. I saw him back about 12 days later when a second application was applied. And then this picture represents the condition of the wound 2 weeks following his second application. And you can see some contracture and some fibrosis in the wound. Some of that is actually the resultant membrane. And we're going to go ahead and look at his third application. So on this next slide, you can see the image on the left is 6 weeks post the first application. This is 2 weeks after the last image we looked at. And again, we have continued contracture of the wound with a little bit of decreased fibrosis, a little maceration around the perimeter. Patient came back the following week for his third application of the CASCADE PRFM membrane. The image on the right is what the dressing or the membrane looks like when it's applied. In this case, I did not steri-strip or suture it. I was able to lay it on and pack it slightly in the central aspect where the recess was. And then over this, I typically would use Adaptic and some 2x2s and Coban wrap and keep the dressing on for a week. And this next image shows the wound 3 weeks following the last and final application of the PRFM by CASCADE. So the CASCADE membrane was applied 3 times, a period of approximately 10 weeks, and the wound is predominantly closed. So in summary on this patient, we've got the chronology of images, what his wound looked like before treatment. The second picture is the wound at 4 weeks following 2 applications. A picture of the application number 3 of the CASCADE PRFM. And finally, wound closure at 10 weeks. Now, to back up these findings from my own personal experience with my patient, we have some studies, and one of them was a study at the VA in Palo Alto, looking at 5 patients with diabetic foot ulcers with a duration ranging from 8 weeks to 5 years, with wound sizes from 5 to 27 square centimeters. Treatment protocol consisted of the application of a PRFM membrane or a gel every 2 weeks for a maximum of 8 weeks, with a final 4-week follow-up, or 12 weeks total. The primary goal was to find 75% healing at 12 weeks and the secondary goal was to see 100% healing by 12 weeks. Well, all 5 of the patients, 100% of the patients, healed at least 75% at the 12-week mark. 4 out of 5 patients had 100% healing at 12 weeks. The mean time to complete healing was only 7.2 weeks, and the average number of treatments was 2.8 or less than 3 treatments. And this is important because when we talk about costs of healthcare, knowing we can take a patient's own blood, create a membrane, and only need 3 kits to get 80% of the wounds closed in 12 weeks, this is wonderful in comparison to the competition where some of these dressings need to be applied weekly. Sometimes they take up to 6, 10, 12 applications, which drives the cost of healthcare up higher than it needs to be. None of the wounds reopened after a 2 to 5 month follow-up, and there were no adverse effects noted on any of the 5 patients. Here we have a 58-year-old male with a diabetic foot ulcer, which was one of the participants in this previous study I just reviewed. And he was healed in 6 weeks with 3 applications of the CASCADE platelet-rich fiber matrix. The upper left picture shows his initial diabetic foot ulcer presentation. The image below that in the bottom left shows the application of the platelet-rich fiber matrix over the wound. In this case, it was placed on in its entirety whole without being cut or trimmed to size, and that's fully acceptable. The upper right corner picture shows the diabetic foot ulcer contracting and reducing in size at 4 weeks. And the picture below it shows how the PRFM was applied to the wound. It was kind of balled up and placed within the recess of the wound and packed and then redressed. Now again, the structure, the PRFM, is chock full of growth factors and platelets, and so it doesn't matter how this membrane is applied. It can be packed, it could be laid on top, it could be cut to size. It doesn't matter if the platelet-rich fiber membrane is upside down or right side up, because it's going to release growth factors in a sustained, coordinated manner, regardless, once it's in the wound, and help to heal these difficult diabetic foot ulcers. So we've been talking about diabetic foot ulcers, but I'm going to show you a venous leg ulcer patient. And again, wounds are wounds are wounds. I mean, they're slightly different depending upon the location. In the way of a venous wound, the underlying etiology and pathophysiology is different than that of a diabetic foot ulcer, but a wound is a wound. So this patient is an 85-year-old female with a 12-month history of a venous leg ulcer. And if we look at the left picture, we have the initial presentation of the wound at 14 square centimeters. 3 weeks post-treatment, we've reduced this wound to 6 square centimeters. And 4 weeks after the 3rd application of the CASCADE PRFM membrane, we've got total closure of the wound, which occurred at 16 weeks. This next case presentation was a very challenging case. We call it healing the unhealable. This patient was a 75-year-old war veteran who had a medial ankle ulceration for more than 53 years. Prior to the application of CASCADE, leading wound care specialists have tried other advanced wound care treatments for many years with no success in completely closing the wound. And after 4 months of application of CASCADE membrane, this original 63 square centimeter chronic wound was fully healed. And we were excited to share that the CASCADE autologous platelet system is available in the VA system with contracts with IDIQ and the Department of Defense. PRP Concepts has been very active developing their next generation Cascade product. With all the properties of the original Cascade system, including the filtration of neutrophils and the lack of need to add extrinsic thrombin to create the platelet-rich fiber matrix, their products allow the elimination of inflammation and assistance with rapid healing of chronic wounds. This new product has proprietary intellectual property with a patent pending, and it offers patients a promising new option in healing and closing chronic wounds. PRP Concepts is excited about this new product and are confident that the data will change the standard of care, allowing the new Cascade platelet-rich fiber matrix to become the gold standard of healing the unhealable wound. Thank you for watching our presentation. For more information about Cascade or PRP Concepts, please visit us on the web at www.prpconcepts.com. That's www.prpconcepts.com.